Yes, I'm Kalle Hoppu. I'm a pediatrician and pediatric clinical pharmacologist. I get my daily living from being the director of the Finnish Poison Information Center. Here in Grip, I'm the work package leader for work package 1 on education. Well, I mean, GRIP is one of the great opportunities we have to work to enable better and more pediatric data becoming available for children and ultimately better medicine. So this is maybe a small step, but it could be an important step. Well, I would like to start with the added value, and the added value is, of course, that if we are expecting to have more data, more clinical trials in children, we have to have more capacity than we have today. And this is a capacity building exercise by the work package 1 by means of education and training, getting more people who know more about how to study and develop pediatric medicines. That's absolutely the added value. When it comes to challenges, I think the challenge is I see primarily it's so that people are not that familiar with high quality education and how it is done. So to be really effectively, we have to come up with new and modern solutions. I mean, this is a common problem in the academics generally. Academics are principally interested on research and secondarily interested in education because they see its value and necessity and it's part of their job, but usually it's still a secondary interest. Well, the Better Medicines for Children initiative at WHO was intended as a complement to the US and European initiatives with the pediatric regulations, because otherwise there would have been a risk that the rest of the world would not benefit and possibly even be exploited for the benefit of these European and US initiatives. Then, so against this background, I think the Better Medicines for Children initiative made some significant steps forward in improving the availability of medicines for children around the world, particularly in low-resource settings. Of course, I have to say that it's a long way to go, but kind of something has started to happen. And in this effort, it's so that development of pediatric medicines, even for developed areas like Europe, is today very global. Many of the studies are done in other settings than Europe, outside of Europe, even in countries which have less resources and even less knowledge and experience in pediatric clinical pharmacology that we have in Europe. So if we can, with the help of the education packages which were labeled as global from the beginning, we can help these countries to understand better the issues related to appropriate pediatric medicines, development of such medicines. I think it serves in many ways the purpose. I mean, we need in these countries regulators who understand something of pediatric medicines. We need the investigators there who participate in the multi-center trials that are used to develop medicines also for Europe and US to know how to do it in an appropriate way, and preferably also to be able to, let's say, get benefit to the local settings of these trials. So I mean, simply the medicine business is nowadays so global that just limiting us to Europe would not serve the purpose